And as you just mentioned folic acid there, Dr. Gordon, of course we should also talk about vitamin B12. Your product Beyond B12, that contains both? How does that work?
It's such an important step. We are living in a time frame in which these toxins that I talk about have helped set some changes in our bodies in an area that we call methylation. And methylation is just one of the methods like acetylation or oxidation or sulfation that we use to help our body push DDT on its way back to CO2 and water. We want these bad things out of our body back to harmless substances. But because of the sad fact that when we drank water out of plastic bottles, we were getting phthalates, and everybody today has 10,000 times the level of phthalates in their blood, just like styrene from the stupid styrene cups we drink out of, and we were able to find bisphenol A in these people, and they have been lied to for years that bisphenol is perfectly safe. It's not, and it's clear now that we have changed overnight. It's called an epigenetic change. In other words, it wasn't, your family didn't have to have diabetes for 5 generations. We can make you diabetic in 1 week. All we had to do was warm your food of your baby in a baby bottle that had bisphenol A to harden the plastic. And then you gave that water to the baby, and the genes changed virtually overnight. And it's all been documented at Duke University by Randy Jirtle, J-I-R-T-L-E, and it's all been special NOVA, calling Ghost in Your Genes, explaining how we took lean, brown, healthy mice, and overnight all of their babies would become yellow and diabetic and obese, just like we've done to America. And so it's pretty sad to realize that we can undo that change when we give adequate methylation support, which is why the vitamin C carries in it, in Bioenergy C, the trimethylglycine methylsulfonamethane, because I need methyl support, but that's not all. I need to recognize that folic acid is such an extremely important nutrient that it can actually treat depression by itself. It can stop you from having what we call peripheral neuropathy with painful toes because you're in the end stages of diabetes. But I have to do it with the right kind of folic acid, and it is so expensive at $15,000 a kilogram. It is not in the packet of BCI. We don't have the correct expensive form. You have to do it the right way. So when I give you methylfolic acid, I give you with it methyl B12. And since B12 was very poorly absorbed in the stomach, we put this in a sublingual. So I'm hitting many birds with one stone. People who are losing interest in life, they're depressed, they're beginning to lose focus, etc. Across the board, anybody with depression, but it's much more important than that. You're not going to reach your maximum intended useful lifespan being in full control of all your faculties unless I have you take one of these under the tongue each day, and I put in it 3 forms of folic acid. So I have the folinic acid and the 5'-methyl tetrahydrofolic acid, which is the very, very well documented, very important breakthrough in understanding some of this, along with the methyl form of B12. And so now it's almost the same as if I gave you a shot of B12, and we have many, many people who a shot of B12 makes them function whereas before they weren't.
Yes.
And now, the New England Journal has published a study showing that there is a condition called cerebral folate acid deficiency syndrome, and this is causing children to have seizures and lack of coordination. And it turns out that the doctor who measures your blood for folic acid, you'd think you could diagnose it.
Yes.
It's normal in the blood, it's only low in the spinal fluid, and who wants to have a needle in their spine?
No.
So it's so important to recognize that unless you have all of the nutrient bases covered, you are playing Russian roulette. And so I tell people, yes, I could go about it scientifically and I could do these expensive tests.
Yes.
But it actually turns out it was actually a folate receptor problem. And the receptor problem comes from all the antigens and toxins, which we are increasingly worried about because we're getting them from so many places. So now we have this epidemic of what we call autoimmune disease, and that's why I designed my FIGHT program. And my FIGHT program is not winnable without understanding that you have to be careful of which food you're eating that you're allergic to.
Yes.
sensitive to?
Yes.
Which food supplement do you absolutely have to have, like vitamin D? You can't do it today because we've all been brainwashed not to go out in the sun, which is so unfortunate because the sun blockers are causing skin cancer.
Gosh.
And so now we have the public really stuck. You have to go to a store and spend your hard-earned money and buy vitamin D. And we could undo that if we get back to facts. It's just like we lied to everybody saying cholesterol is the problem, when it's really blood clotting that's the problem.
Yes, yes.
It's so difficult to have the facts out. But this simple product is going to markedly reduce the number of people in old folks' home who don't know who they are, and the number of children who cannot learn. Because it is the form that the body has. It's the actual real folic acid, not the synthetic one that's affordable, that's in 99% of all the multiples that we all take.
Yes, yes. Oh, thank you very much, Dr. Gordon. It's nice to know that you're enabling people with simple solutions to what are complex problems. Thank you.
My pleasure.